Okay, hey everyone. I've seen a ton of questions come through this channel asking about PCOS. And so I've brought Kina here. She is a hormone expert, a women's health expert. Just, Kina, tell us real quick why they should listen to you while we talk about PCOS.
All right, you got it. So with PCOS, basically, this didn't even be an issue like a generation ago. This wasn't even something that was well known. It wasn't something that was like a commonality. And now it is everywhere. It's a really interesting phenomenon that has happened that in the last 20 plus years, all of a sudden, when I was growing up, I'd never even heard the word,
Yeah.
like I'd never heard of PCOS.
What does it stand for? What does PCOS stand
Yeah.
for?
Oh, yeah, good question. So it stands for Polycystic Ovarian Syndrome. And basically, what it means is that a couple of things. One of the things is that you might have cysts on your ovaries, which can be very painful. But it can also have to do with an androgen excess. And part of that is why you get the cysts on the ovaries. And not everyone that has PCOS does have cysts. But
So you said androgen excess. Do you mean
yes, sorry.
testosterone?
Yes. So testosterone, DHEA, some of these types of builder grower hormones, what happens is it's also basically, in a lot of cases, it's a progesterone deficiency. And so what happens is the ovaries will spit out their estrogen, and you have the female has her cycle where she's going to be kind of proliferating and growing for a nice little space in the uterus, so that if there is any sort of implantation and the female's able to get pregnant, well, then there's a nice fluffy area for that egg to start to grow and be taken care of. So when the female is not going to be pregnant, the progesterone is what helps to kind of shave everything out and get it cleaned out. So with PCOS, there's not enough progesterone going through to help clean things out. So then there's an over proliferation. So it can cause a lot of things like acne and weight gain, facial hair, and of course the ovaries on the cysts are miserable. I remember when I worked in the ER having females come in, and I mean, it was not a pleasant experience for them.
Yeah.
And those things would burst. So part of it is that there's just an imbalance in things. So for a lot of females, the traditional therapy is that they're put on metformin, maybe they're given spironolactone, which is a medication to help with the androgen excess so that they don't get as bad acne and the hair and some of that stuff. But a lot of it is not just my opinion, but a lot of the research is showing a lot of it has to do with the environment that this generation is growing up in now. It's just really messing with their hormones because the foods we're eating, the foods we're even cooking, are like the plastics and the BPA and all these types of things, the hair products, the lotions, they're all messing with hormones. So it's throwing everything out of alignment. On top of that, a lot of these girls, females, not all, I'm just saying it's a generalization, are not exercising like they need to help balance some of this stuff. They have insulin excess and insulin insensitivity, which is then causing them to become pre-diabetic or diabetic younger. So it's a really ugly, vicious cycle that's going on here. So with PCOS, it's a little tricky, but once again, lifestyle is always foundation. So if I have a female coming in with PCOS and she eats garbage, never works out, is stressed out of her mind, doesn't get enough sleep, well, one of the first things we've got to do is start to get all those things in alignment. We got to start cleaning up their nutrition. We got to start getting rid of those androgen and those hormone disruptors. We've got to get the sleep going because that's when the body heals. That's when we get the human growth hormone. That's when we get repair going on. Same thing with the stress.
So
got to start managing that.
Do I understand you wouldn't go straight to hormone therapy in this case? You're going to clean those things up. And the androgen excess, how do you deal with that? Does lifestyle really clean those up?
Well, I'm not going to say that lifestyle is a fix-all 100%, but what I am saying is it'd be like, I'll use the example, if your car had, a flat tire and you just kept putting a piece of gum over where the hole was and saying, well, I'm just going to keep going and I'm going to put really good fuel in my car and it's a really expensive car. I know I have this hole in my tire, but I'm just going to keep putting a piece of gum over it to keep it, and I'll fill it up every couple of hours. Like, let's fix the foundational problems And I'm not saying that we don't go in and try to also at the same time heal some of these other issues, but it's something that can be managed. And hopefully, for most of these women, they'll be able to live a really good, healthy, fulfilling life, and this won't take over. And there are tests we can do. Like, I'm a big fan of the Dutch test because it shows, it's a dried urine test, and it shows, hey, which metabolic pathways are your hormones taking? And how can we heal this metabolic pathway that is not a healthy one? And let's instead try to drive it over into this healthier, pathway to get things fixed. So once again, we test, we don't guess. We don't have to be like, well, maybe this, maybe that. We can take a look, and we have such great ways now that we can really get a better idea of what's going on so we can better heal, not just from the bottom to the top, but while we're doing that, from the top to the bottom, meet in the middle for optimal health.
I don't know if this is crazy or if I'm off base. I've talked to some women who have PCOS, and their doctor just threw them on birth control.
Yes,
Have
a
you
lot
heard of
do.
that? Why do they do that? What's the logic behind it? And does it work?
Yes, it can. And the reason why is because they can help balance out those hormones so that it's not quite as out of control. So it's better than gum on the, flat tire kind of a thing. I'm not a huge fan of, and I know that there's a place for them, and I leave that to the OBGYNs, but I'm not a huge fan of the synthetic birth control methods. I just find that there is a lot of difficult side effects and long term that can cause problems, and especially as the research comes out even more. So I'm not one that I immediately put a patient on a birth control. I try to find other more natural and less damaging side effect approaches.
Okay.
So, like I
We're
said,
gonna
I'm
have
not anti-birth
in a
control.
future video, we're going to talk all about birth control. So,
Oh,
so
it's a
I'm
tricky
looking
one.
forward to that video.
Yeah, it
Some
is a
women
tricky one.
ask around PCOS, what does it do to my fertility?
It's a good question. Everyone's different. Some women have a very difficult time getting pregnant with it, and others, they are fine. So it's kind of a case by case basis. And not to beat a dead horse, but if I do have one, I have a patient right now. She has PCOS. She's 24. She wants to get pregnant. We just did a Dutch test on her, so I'm waiting for those results. But really, once again, their lifestyle is going to be the first place I start to fix things. So
Okay.
if they're eating a lot of crappy food, if they're not exercising, if they're not sleeping, if they're stressed out of their mind, we start there.
So if someone runs into this video, they have this situation, they really relate to what you're talking to. What I'm understanding is you'd have them start with their lifestyle changes.
Yes. And it doesn't mean we have to do only that, but in conjunction, I'm always going to use that as our foundation as we're testing, as we're identifying, where they have deficiencies. I mean, something basic as vitamin D. 95% of my patients have vitamin D deficiencies. We live in Utah. We're in a hemisphere that we just don't get as much. So there are some foundational deficiencies that we got to fix those before we try to get bigger stuff. We got to fry the small fish before we get to the big ones.
So I think your time is up. You have to see patients. I'm trying to think of the best way to wrap this up. I have lots of questions like, how do I know if my irregular periods are because of PCOS, or can it be managed without medication? Let's give your last 30 seconds of wisdom to those people who find this, maybe don't have the support that that you're able to give them. Just give that final wrap up, and then we'll look forward to the next video.
You got it. Well, I think I kind of said this before. Number one, there's hope. So don't give up hope, and don't just be like, oh, I'm just, have to live this life and be in pain and feel awful and whatever. There's always a solution. I always tell my patients that. I'm like, sometimes I'll tell them, I don't know the answer, but I know there's a solution. So we're going to find it. We're going to research. We're going to, go down these rabbit holes. Let's find the solution. But the foundation for you is, of course, those 4 pillars of good health, because those are going to make a difference. And then on top of that, we do have really great options. We live in a great time. We do have really solid supplementation. We have medications that are wonderful and can be used appropriately. We have bioidentical hormones that can be life-changing for people. So we live in a space and a time where we have a ton of information at our fingertips, which can be good or bad. We have a lot of options. So if you're really serious about this, look into finding a provider. If you can't meet with us, find a provider that's near you. They're out there. And take control of you. Don't wait for someone else to do it for you, because they won't. And then you'll be disappointed and then you'll be frustrated. So take control, find someone that works for you, that can kind of sit in your lane with you and support you and cheer you on and give you safe and effective advice or safe and effective medical care. But if you're not interested in going down the traditional allopathic route, there is another way to go about it. And there are a lot of great providers out there that can help you. So don't give
Awesome.
up hope. Keep going. Yep.
Thank you so much, Keena. Have a good rest of your day, and we appreciate your time. Thank you.
You're welcome. Thank you. Have a good day.